unlike Atlanta, many smaller cities around the state are still waiting for a COVID-19 vaccine to arrive. Joe Hankey talked with healthcare directors in rural Georgia.
As they watch COVID-19 doses arrive at many Atlanta hospitals today, clinic directors from rural Georgia told me they've applied for doses for their own staff, but they still don't know when they will arrive. It could be as soon as tomorrow. It could be longer.
I think it's always a fear that the little guy gets forgotten. It's a fear with our county hospital. It is also a fear with our clinic.
Sherry Beavers is the executive director of Open Arms Clinic in Toccoa. She applied for doses of a COVID-19 vaccine for her staff, but so far, no word on when they will come in. Until then, her staff is only seeing patients virtually.
It's not the same as being able to assess a patient in person. And it's very difficult to say, could you show me this part of your body or that part of your body?
Once her staff is vaccinated, in-person appointments will resume. Until then, she is trying to think of how she can best help her patients.
If we have a patient with congestive heart failure that we're monitoring their weight very carefully, we've provided them scales, diabetics, monitors and strips.
Georgia Department of Public Health Director Dr. Kathleen Toomey previously said she wants the vaccine to be distributed statewide equally in rural and metro areas. One holdup, though, could be storage. Pfizer's vaccine needs expensive ultra-cold storage units to extend its shelf life. Moderna's does not, and it might be the only option for some rural areas. Beaver says that is not an issue in Toccoa, but some other healthcare directors in smaller communities tell 11 Alive they do not have the storage needed to keep a Pfizer vaccine on hand. And with limited doses of Pfizer's vaccine available right now, healthcare leaders that we have talked with are hopeful Moderna's vaccine will receive final authorization in time for it to start distribution as early as next week.